Today we are going to discuss about pertussis, otherwise known as whooping cough. So what is this? The pertussis or whooping cough, it is a highly contagious infection of the respiratory tract, particularly seen in infants and young children. So what causes it? It is caused by organism known as Bordetella pertussis. Also other organisms like Bordetella parapertussis, Bordetella bronchoseptica as well as Bordetella holmesii. Your parapertussis causes pertussis-like infection, whereas your bronchoseptica and Homsey are particularly seen in immunocompromised patients. So, how is the transmission? So, it is a toxin-mediated disease. So, the organisms they go and they affect the respiratory ciliary epithelium. They get lodged there and they prevent effective clearance of secretions from the pulmonary region. And secondly, the Bordetella pertussis releases pertussis toxin. Apart from ciliary paralysis, it also has other functions like histamine release, insulin secretion, leukocyte dysfunction, and other activities which are not going into much into the detail. And there will be a tracheal cytotoxin which destructs the cells and it further prevents the organisms from getting cleared from the airway. So, what are the clinical features? So the classical pertussis presents with three stages. That is, one is a catarrhal stage, paroxysmal stage, and other one is a convalescent phase. The catarrhal phase, these symptoms are usually seen within 1 to 7 days after exposure, and there is an incubation period of 7 days. Following which there will be a catarrhal phase. So this catarrhal phase, it usually lasts between 1 to 2 weeks, where the child usually presents with cough, chorea, and conjunctival congestion. And the second one is most important stage, which is a paroxysmal stage, where the child has inexorable continuous paroxysms of coughing and inspiratory whooping, and there will be a post-stress vomiting. And the third one is a convalescent phase, where all your symptoms starts coming down in the next 1 to 2 weeks. So what when we call it as a suspected case of pertussis. A suspected case of pertussis is known as cough of more than 2 weeks duration with any one of the following. That is either paroxysms of coughing and inspiratory whooping, post-stress vomiting. Also, if in an unimmunized child, if cough of any duration, you need to have a high index of suspicion. What are the complications which we can expect in pertussis? So, pertussis, there may be complications like hypoxia of the brain, there may be seizures, they can be encephalopathy, they can be bilateral conjunctival hemorrhage, they can be persistent post-stress vomiting leading to failure to thrive, and they can be rectal prolapse, they can be interstitial pneumonia, and as well as pulmonary hypertension. And what are the investigations? So the investigations usually we have to isolate the organism, we have to take a posterior nasopharyngeal specimen, and apart from that we have PCR, which is polymerase chain reaction, to know the DNA sequence, and we can take serology is quite useful during the convalescent phase. So what is the treatment in pertussis? Usually in the acute phase, usually we take care of hydration. That is, you have to properly hydrate the child because he will not be in a position to take orally. There will be continuous post-stress vomiting, and you have to continuously clear the secretions. But too much of suctioning needs to be avoided, and you have to take care of the airway. And coming to antimicrobial treatment, these antibiotics needs to be given within 5 days. So the what antibiotics we usually use is either we use azithromycin, erythromycin, or clarithromycin, but we have to be careful. This azithromycin, and clarithromycin, they needs to be given for 14 days. This erythromycin and clarithromycin needs to be avoided in infants who are less than 1 month of age. If at all the child is intolerant to macrolides, the we can use cotrimoxazole, but you have to be careful by using cotrimoxazole because cotrimoxazole is to be avoided in infants who are less than 2 months of age. So these macrolide antibiotics help in complete eradication of Bordetella pertussis within 5 days of start of the antibiotics. So when is hospitalization recommended? Hospitalization is recommended usually in infants who are less than 4 months of age, who have continuous post-stress vomiting, who will be not be in a position to take orally, or there are severe signs of dehydration, or the child is critically ill, then we have to admit the child. So what is the prevention? The prevention is your vaccination is a very successful strategy. So we have to complete our primary as well as booster doses of immunization. Primary at 6, 10 and 14 weeks, which includes pertussis, either it may be acellular pertussis or whole cell pertussis, as well as your booster doses at 1 year, 6 months, and between 4 to 6 years. The Advisory Committee on Immunization Practices also recommends Tdap in adults who are more than 65 years and who are in close contact with the infant who are less than 1 year of age. And it also recommends the pregnant women to take a single dose of Tdap between 27 to 36 weeks of pregnancy, and all household contacts who are less than 21 days and who are in at high risk of the disease, usually the preventive prophylaxis needs to be started. So the pertussis or whooping cough, it is dangerous, highly contagious, but still it is formidable. We have to complete our primary and booster doses to completely eradicate it and to save our child.